Coming of Age is coming up next. I'm your host, Josh Newby. First up today, we'll look at how a local hospital is adapting to this pandemic and still providing care, and what you need to know. Then we'll look at how ageism affects the seniors in our community and how ignoring them for a job could be both yours and their detriment. Finally, fraudsters stop for nothing, and in fact, they even excel during times like this. Stay tuned to learn what you need to know to keep yourself safe. Coming of Age starts right now. As we age, staying active in life and involved in the community can become a challenge. But with Council on Aging of West Florida's range of home-based services, you remain healthy, independent, and engaged. From Meals on Wheels and respite care to senior dining sites and the retreat, you'll feel empowered to regain your freedom while retaining what makes you, you. We've been in the community for nearly 50 years, advocating for elders and supporting those who care for our parents and grandparents. We were there when your father's health began declining, when your mother needed companionship during the day. And guess what? We'll be there down the road when you need those services too. Now, join with us as we talk together about the aging issues that matter to you. COVID-19 has disrupted our lives in many ways, including the way hospitals have worked to meet the healthcare needs of the community during this crisis. Unfortunately, during the past few months, many people postponed seeking care when it was needed, worried that they would be infected by the coronavirus. Now, as we move into a phase of recovery and services such as elective surgeries have resumed, healthcare professionals want to make sure the community knows they can return to the hospitals and doctors' offices without worrying about their safety. Baptist Healthcare President and CEO Mark Faulkner is with us today to talk about all the measures that have been put into place at Baptist to keep patients and team members safe and healthy. Mark, thank you so much for joining us today.
Thanks for having me, Josh.
So tell me, what can people expect if they come to Baptist Hospital for a doctor's appointment or for a procedure?
First, things are a little different. We have limited the number of entrances, and we are screening all patients and visitors, just checking temperatures, asking a few questions, making sure that we're being very vigilant with respect to controlling any additional spread.
Sure, and that makes sense. So if I go to the hospital or to the doctor's office, can a friend or family member accompany me, or is that still advised against?
Well, like all hospitals across the state, across the country, we're limiting visitors. We certainly would encourage patients who are able to come to an outpatient appointment, doctor's appointment, and the like, to come alone. Yet we also understand that often we need that support person or persons, so we do encourage that as well, and that support person be present with them. And again, they'll also be going through the same screening process as we do for others. And this is changing, so I would encourage folks to check our website, ebaptisthealthcare.org, as those visitor requirements change over time.
Sure. So let's talk about masks. Do people have to wear a mask when they are at Baptist Hospital?
Well, we have followed and continue to follow CDC guidelines, and that includes the wearing of masks. We require all of our team members, our employees, to wear masks when they're out in public settings or at their workstation in which they cannot socially distance. This is a highly contagious virus, as we all know. Mm-hmm. And so we do know that people that might actually be positive but yet be asymptomatic, in other words, they have no idea they have it, might be the cause of spread. So we screen our employees daily. We ensure that they're wearing masks, and we are confident that that will continue to reduce the spread.
Okay. Now, what if I show up and I just don't have a mask?
Well, we encourage all of our visitors, all our patients, to bring their own mask.
Okay.
CDC also offers guidance on how to make your own mask. It's good that the supply chain in our country has caught up. And so you can order masks online. But if you don't have a mask, we will provide a mask for you.
Okay, perfect. Talk about other changes that you've made to protect people when they arrive for a doctor's appointment, because I imagine there is a bit of anxiety present with that.
There is. And much like we've seen in retail and other locations, we have changed the way we have set up and configured some of our public space. For example, you'll notice the clear glass shields that now protect and separate the registration and other job roles with the patients and the visitors. We have created social distancing in our waiting areas, making sure there's adequate space between seating arrangements and the like. Just, again, trying to promote that separation within our facilities.
Sure. Now, do you offer telehealth? Telehealth services have gotten, a lot of publicity recently because of social distancing. Is that a current alternative to some face-to-face visits?
It is, absolutely. We are offering telehealth, and we're offering that in a format that you actually see your own doctor, not a doctor across the country or even overseas. These are the local physicians who have been providing care in the community are now accessible via telehealth services. In fact, I think we've done almost 14,000 visits now just in the last several weeks alone. So we have ramped up capabilities. It's been very well received by our patients. We know that many would prefer to see their physician in person, and we continue to offer that, and now also offer the platform to be able to see them electronically.
That's good news. So just to sort of put it bluntly, should I be concerned about COVID-19 if I have to be admitted to the hospital?
It's a great question, and it's a legitimate concern. Yet hospitals, I would argue, are among the safest places you can be in our community. We are accustomed to taking care of infectious diseases. Our staff are trained. We have adequate personal protective equipment. We've ramped up our infection control, our cleanliness, especially in the common areas, now getting hourly checks and cleaning. We are continuing to follow the CDC guidelines. We have separated and created units that now care for the COVID positive patients, and we continue to see very, very low numbers of inpatients here in our facilities. And again, they are in their own dedicated unit to prevent any overlap and exposure to visitors and patients and the like. But we take care of infectious patients every day. And during this COVID pandemic, we have cared for COVID patients, but we have also cared for a tuberculosis patient. Mm-hmm. We cared for a SARS patient. We do this every day. And we've done it successfully and safely, not only for patients and not only for visitors, but also our employees as well. So I would encourage people to be confident and understand that we are prepared and we are managing the situation. I'm actually more concerned about statistics I'm hearing now from the CDC. Although we've had over 100,000 deaths in the U.S. associated with COVID, estimations are up to about 40,000 excessive deaths, unanticipated deaths, due to patients who have postponed their care. These are cardiac issues, cancer issues, other issues that folks that had been concerned not access health care and unfortunately passed away unnecessarily. So, it's a very concerning statistic as well. So I would just, again, encourage the public to understand that we are being very, very safe, thoughtful, and deliberate.
That's a great answer and very encouraging. Mark, we are all out of time, but I appreciate you so much. Thank you for joining us today.
Thank you, Josh, for having me. Talk to you soon.
Next on Coming of Age, we'll speak with Landrum attorney Amy Remington about ageism in the workplace. Stay with us.
Why do people love ACT's retirement life communities? There are more reasons than just the active lifestyle. Like ACT's Life Care, a plan that protects your nest egg with predictable monthly fees, even if your healthcare needs increase. So you can enjoy a carefree today and a worry-free tomorrow. Plan a visit and see why our satisfaction rating with current residents stands at 98%. ACT's Retirement Life Communities, where loving kindness lives.
What does it look like when a life is truly changed? I feel a sense of accomplishment because I built a house. This house has brought us financial independence.
It's a great place to raise a family.
Strength, fuerza. When I look back where we've come from to where we are today, it makes my heart very happy.
Potential.
Potencia.
For me, this house means all of us together.
So,
Security.
Security.
Every family dreams to have their own house. This house changed our lives.
Habitat for Humanity is at work in your community and around the world. Through shelter, we empower.
Many isms are scrutinized and criticized in today's workforce: racism, sexism, etc., and for good reason. But there's one that seems to persist, at least subconsciously, and it can have real negative economic and emotional disadvantages. I'm speaking of ageism, and it affects older folks as well as younger ones. Here to give us the details and tell us about some of the legal limits around ageism is Landrum attorney Amy Remington. Amy, thank you for coming on today.
You're welcome. It's nice to be here.
So, what is ageism? What does that entail?
So you described it well in the beginning, because it is something that is insidious and it seeps into the way that we think. And what ageism is, it's perceiving something about somebody else based on their age. Maybe that they can't do something, that they're not physically able to perform a task, that they're too old or too young to learn something or to change. So ageism is insidious, and it seeps into all aspects of our society. I mean, gosh, you don't have to watch very many movies to see how older people in particular are portrayed. Right. And my experience is that that's just simply not accurate.
Right. But beyond being, not accurate and certainly insulting, at what point does that ageism become illegal, especially in the workplace?
So sure, there's a very definite answer to that. So under federal law, there's a law called the Older Worker Benefit Protection Act, and then there's another law called the ADEA, which is the Age Discrimination in Employment Act. So under the ADEA, an employer may not make an employment decision because of somebody's age if that person is over 40.
Okay.
Under the Older Worker Benefit Protection Act, which is also the other federal law, if an employer is going through a reduction in force, for example, or is terminating somebody as part of a severance plan, they can't make a decision based on somebody's age, and special terms have to be in the agreement that the person signs to waive their rights. Okay. Now in Florida, it's a little broader. What Florida says is an employer shall not consider somebody's age for any reason at all. And I actually had a case many, many years ago where a woman who was in her 30s was not hired at a particular place, and she said it was because she was considered too old at 30.
Wow.
Right. So she brought a lawsuit.
Sure.
And we handled that. So it is in Florida, it can be any age at all, but under federal law, the magic number is 40, which I still think is extraordinarily young.
Yeah. Let's talk about those old folks over 40,
right.
in their senior years. What's the benefit of having older folks in the workplace?
Well, so Bert Thornton, who many people in Pensacola know, wrote a great book called Find an Old Gorilla. And it has great insight on the things that people who have been in the workforce for a long time have to offer and have to share. Because, of course, part of being educated is experience. And learning from people who are older and have more experience, it creates a lot of diversity in the workplace, a lot of interest in the workplace, a lot of depth in the workplace. To have people from all, whether you're a millennial, a Gen X, or a baby boomer, having that mixture of people creates a great depth to the workplace, both for the employees as well as any patients or customers that you might have.
Okay. Now, coronavirus has introduced an interesting wrinkle to all of this because it has so disproportionately affected older folks. The governor released a stay-at-home recommendation for folks 65 and older. I'm curious, what can employers compel their employees to do and not do? Can employers compel their employees to come to work even if they're 65 and over?
That's a great question, and that's a question that I've gotten a lot of times in the past, month or two.
Sure.
Because the executive order did provide a recommendation that if you're immune compromised or if you're over 65 or you have some other conditions, that you not report to work. But somebody who is immune compromised, or somebody who is pregnant, for example, or somebody who is over 65, they know that they're immune compromised or they're pregnant or they're over 65.
Sure.
And they're adults, and they can make that decision for themselves in conjunction with whatever healthcare provider they use. So an employer cannot say, you are over 65, you may not report to work. It is a recommendation, but I know many, many people who are over 65 who are in fantastic shape and perhaps in better shape than their 25-year-old counterparts. So you can't compel somebody not to work, but you can ask that all employees equally obey rules about social distancing, about mask usage, about sanitation and hygiene and washing your hands.
Okay. Talk about advice that you have for seniors who feel that they are being discriminated against in the workplace. I'm thinking not only of being laid off because you're older, but just a general discrimination in the workplace.
Sure, and an example of that would be that somebody says, well, gosh, this person is too old to learn this new technology, so we're not going to promote them or give them an opportunity. That's an example I hear all the time. So the first thing I would say is that your human resource partner, whoever that is at your workplace, or if you're a Landrum HR client, for example, that person can walk you through that. And maybe there is some retraining that's necessary. Maybe it's not related to age. Maybe it's just retraining in general. But the human resource partner is the first place to start. If it's not resolved and somebody really in their heart believes that they've been discriminated against, the Florida Commission on Human Relations is a state agency to go to, and the Equal Employment Opportunity Commission is the federal agency to go to. But it has been my experience in the 20 whatever years that I've been doing this, that 90% of problems can be solved if an employee goes in good faith to their human resource partner and works with them and determines whatever the objective reason is and what changes maybe the employer needs to make and the employee needs to make. They can work together and solve that problem without state or federal intervention.
Sure. Now, I'm glad you brought that up because you work with Landrum, and I imagine you see this sort of thing day in and day out. I guess I'm asking you, just speak candidly, how do you see ageism affecting work, maybe from a management perspective, from an HR perspective? Is it as pervasive as we feel it is?
Well, at Landrum HR, we work very hard to make sure everybody's included, regardless of sex, color, race, religion, any protected status at all. And so our HR partners work very closely with our clients to ensure that those kind of isms don't occur.
Sure.
And if there is, for example, a reduction in force, one of the things that has to happen on the Older Worker Benefit Protection Act schedule is you have to tell somebody, here are the positions we're retaining and the ages, and the positions that we're not retaining with those ages, so that somebody can say, well, gosh, everybody over 60 is gone.
Right.
Or, oh gosh, I'm the only person over 60, and yet there's 5 over 60 who have been retained. So it gives you an objective basis to determine whether there might be an element of age discrimination or any other ism, but specific to age discrimination with that particular act.
Definitely. Amy, it's great advice. Thank you for shedding light on that. I really appreciate your advice.
You're welcome. You're welcome.
Up next, we'll discuss a perhaps unforeseen side effect of the coronavirus. Stay with us.
Since 1989, TLC Caregivers has been providing the special help people need to stay independent in their own homes. TLC is an employer of choice in the home care market. Our employees are screened with level 2 background screens, drug-free, and have caregiving experience. If you have time, enjoy people, and are interested in joining us, go to tlccaregivers.com to learn more about becoming a TLC caregiver, or visit us in Cordova Square.
When cancer tries to take you away from the things that matter most, Baptist Cancer Institute offers caring physicians and the most innovative treatment options. With convenient locations and a wide array of support programs and services, we're here to help you during the most difficult of times. As a member of the Mayo Clinic Care Network, we're bringing even more innovative cancer care to our community right here at home. When you need cancer care, we'll be there.
Unfortunately, the global pandemic has had many negative side effects beyond the physical and mental challenges. It has also given rise to a whole host of new frauds, as if we didn't have enough to worry about already. Well, here to separate fact from fiction, as well as provide some useful information on free insurance counseling for seniors, is Marty Hearn with the Area Agency on Aging. Marty, thank you for coming on today.
Thank you, Josh. I really appreciate it.
You know, I don't even know where to begin with these scams and frauds. These people, they just take advantage of every, exactly. They're so exploitive. Yep. I wish we could stop talking about them, but here we are. Talk about the scams and the frauds that are unfortunately associated with this pandemic.
Okay. Well, let me go back to 2018. In 2018, $800 billion was spent on health care. Of that, 60 to 90 billion was lost to Medicare fraud and abuse.
Yeah.
And that impacts all of us, all taxpayers. It impacts the health and welfare of the beneficiaries as well. This year, the COVID-19 pandemic has created an explosion of websites, emails, and scammers going door to door promoting testing, cures, and medical equipment and supplies. Scammers are basically profiting off of people's fears. And they use websites, for example, that look official, like they're official government sites. They offer tests by mails that are not FDA approved yet, obviously, and false cures or vaccines. And we all know that there haven't been a developed vaccine developed or approved yet.
Right.
So Medicare Part B will pay for a clinical laboratory test for coronavirus. That's available. However, scammers are using seniors' Medicare information and in some cases even Social Security numbers to falsely bill Medicare for thousands of dollars for each test. And these billings are backed up with falsified data, and the senior never gets results. And the bottom line of all this is they're stealing the senior's identity.
Yeah. Which is, I don't know. I don't have words for people who do that, especially during this time. People are vulnerable. People are looking for hope. This genetic testing scam, we heard about this last year. I feel like maybe we heard about it for a couple years now. It's very shrewd. It's very clever on their part. I'll give them credit for that. But of course, it has an additional dimension now with COVID. Talk about this genetic testing scam.
Well, as of last year, you know, we had sort of nipped it in the bud here in the Panhandle, Florida. It hit us real hard, and then through your show and other shows and getting the word out through healthcare providers and stuff, we were able sort of to cut it off at the knees by September. And they actually had a major arrest in the genetic testing scams going on in our area. Quite a few doctors, not any local doctors, thank God, but quite a few doctors and laboratories that were located in Florida and Alabama and Georgia were shut down. But what has happened now with the COVID-19 testing is that the genetic testing scam has evolved into COVID-19 testing scam. And scammers are basically using the same simple test kits that they were using in the genetic testing scam. You know, swabbing their cheek, you know, things like that. They set up stands in unusual locations, go door to door offering the testing, call seniors. They're calling them on the phone and saying, we'll mail you a test kit. Again, this is not an FDA-approved test kit. And mailing them these kits. And then they're also, in order to do this, of course, they're asking for the senior's Medicare card number, lots of cases Social Security information. Why not? If they got them going with their Medicare information, their personal information, sure, we'll ask them their Social Security number. Then falsely billing for tests, medical devices, and other services. In a case recently released by the Department of Justice, a Florida man pled guilty to conspiracy to defraud the United States in connection with schemes that commit health care fraud. A doctor based in Gainesville, Florida, as a matter of fact, and a co-defendant in the case, authorized genetic testing for hundreds of people across the country that he had never seen, examined, or treated. and he falsely certified he was treating these patients as their treating physician and received kickbacks from laboratories in exchange.
Right.
In 2018 alone, Medicare paid, this is an actual case that Department of Justice just released. In 2018 alone, Medicare paid at least $4.6 million to the clinical laboratories involved in this case, and also they paid out at least $1.8 million in bribes or kickbacks to the individuals involved. So fortunately, you know, we're shutting them down, but it's like you shut one down,
and
another
10
one
more pop up. Exactly.
right.
Well, I mean, it's good to hear that they're being successfully prosecuted. I know the Florida Attorney General has made that a priority of hers.
Yeah, the wheels of justice turn
That's
just
good.
a little bit slower sometimes than the scammer's wheel.
Talk briefly, because I do want to have time to get to the SHINE program. Talk briefly about how seniors can stay safe.
Well, the thing is they need to protect, detect, and report. Protect their Medicare card. Protect it like as if it's a credit card. Never give it out to people over the phone or online. Never do that. And be cautious of free medical services. It's just like your mom always told you. If it's free, it's probably too good to be true.
That's right.
They need to detect potential fraud and scams by looking at their Medicare summary notices and their explanation of benefits, looking for charges for items or services they didn't receive, billing for same thing twice, and services not ordered by their doctor. And then reporting that to the Elder Abuse Hotline, which is 1-800-96-ELDER.
We have just about a minute left, but talk about the SHINE program, which is a free program that seniors don't have to be wary of.
Well, it's free to the people using the program. The federal government, because I just said don't go for free, but it's a totally unbiased program, but it's funded by the federal government through each state. In Florida, it's funded by the Department of Elder Affairs, and we basically have counselors in my area, PSA 1, 4 counties that do free Medicare counseling for seniors. They can help them with billing errors and issues, and also help them examine their Medicare summary notices for these issues. And they will also handle reporting it to the proper authorities, which is the Office of Inspector General.
Awesome. And we will have that number for the SHINE program on the screen. Marty, thank you so much for coming on today. I appreciate it.
Thank you, Josh. Thank you for having me.
Of course. And until next time, enjoy life. You've earned it.